All right, let's try this again. What do we feel like seeing? What do we have here?
I'm stabilizing his head. My fingers are relaxed. I have a nice athletic stance. And I set. I'm lower. Say I'm on 6. I'm more uphill. Set. Sorry, Wade.
All right, so that was. All right, there's a lot of things good, a lot of things not good with that.
I'm stabilizing his head. My fingers
All right, look at his spine.
are relaxed.
This is a dished out thoracic spine. You can see how it's coming back toward me. This is not a candidate for putting on the knee chest. When it is overly flat like this, you'll likely have to do this on the high-low or do it in the chair, more than likely in the chair. When it's this flat, they're getting pushed into this terminal extension. And now with the knee chest, with the chest support, you're pushing them into more extension. So you're locking the backs of the thoracic. So that's why you can see with this first thrust how it almost doesn't go anywhere.
Stabilizing his head. My fingers are relaxed. I have a nice athletic stance. And I set.
See, the technique isn't bad.
My fingers are relaxed. I have a nice athletic stance.
Probably a little too high. You can see how if I was wearing a tie and you dropped it, I'd be like right in front of it. So I would likely bring my head maybe 3 degrees this way to get underneath that disc. Yes, I'm holding down his head. It's a good stabilization. It's surprisingly a lot more head pressure than it is an actual thrust. And know that all this thrust is coming from my legs and my abs. My elbow angle should not change. Watch my elbows. See how they don't change? So that means all this force is being translated. All this force is being translated from my legs through my arms by a conduit of connecting my abs. So everything is coming from my legs, wham, right into him. And my arm supports his head, but I am not extending at the elbows. This is not a chest workout. If anything, it's an isometric hold at my chest, an isometric hold with my biceps, triceps, and my lats, because that allows force transfer. It's allowing the force to transfer from my legs through my arms and into the body. And I have concussion forces being driven into the body with stabilization. I have a couple points of stabilization here. I have the actual chest piece itself. I have his legs. I have my arm. So all these points are allowing the forces to be shot directly through this joint and be brought forward. So those are the mechanical advantages of using a knee chest. For the sake of the demonstration, it's fine, but whenever you see a dished out thoracic spine like this, you do not want to put them on the knee chest typically. Bam. Bam. See how it just slides up.
Lower.
See, whenever I lift my hands from somebody, you recount. The nuchal ligament buckles at C6, and you have that vertebral prominence at 7, 6, 7, 1, 2, 3, counting all the way down. Every time you raise your hand, you do not know where you are, so you put your hands back on the patient and you count.
Say I'm on 6.
Single hand contact. I'm contacting the posterior inferior portion of the spinous. It looks like 6. So technically that's not true. You're getting on the posterior inferior lateral portion of the body because the spinous processes are imbricated. What that means is they overlay each other below T4. So if I get on the posterior inferior lateral portion of the spinous of anything below T4, I'm technically on the body of one below. So posterior inferior lateral portion of the spinous of T4, I'm technically on the body of T5. So I'd be jamming T5 or I'd be jamming T4 inferior. So not going to help the patient. So when I get on it, I'm counting T6, and I come to the lower end of the body and just lateral. That way I can thrust through the center of mass. And single hand contact, soft piezoform, crossing spine, relaxed fingers.
More uphill. Set.
And you're going uphill. So remember, all adjustments are 3-dimensional. There's no such thing as straight lines. I don't know how many times I have to say this. You go up the facets, through the disc, and down. It's like a scoop. Wham! That way. And that's going to give you that deep disc set. How many joints are involved with a thoracic vertebrae? 10. You have the facets above, facets below, the disc above, the disc below, and the 2 demifacets on each vertebrae. 2, 4, 6, 8, 2 discs, 10. So that's why you get a lot of pops with the thoracic spine. You're popping all those joints at the same time. That's why even when you are specific and on one segment, there's a lot of noise. That's okay. You just want to be as specific as possible, getting on that one, getting on the exact one you want to move, the right way, the right time, the right depth. So I'm staying underneath him. I'm uphill running here. Again, all my pressure is coming from my legs, conduit from my abs, and then through my arms into him. My points of contact here are my single hand contact with stabilization of my wrist. I have the point of the knee chest, and I have his knees. Those are all stabilizing factors. I'm going to get underneath it. Pretty much everything below, I don't know, even T1, I can run uphill. Upper thoracic, so T2 all the way up to atlas condyle, you're going to be standing more parallel. When I get T2 below and even into the lumbar and sacral areas, which I don't recommend doing sacrum on here because it's a weight-bearing unit, I'm going to be running uphill. I'm going to be setting these things up the facets through the disc and down. So watch my arms. They don't move. So my elbows do not move. Do not move. Bam. Throwing my chest. Bam.
More uphill.
Boom.
More uphill.
Boom. So, and that one probably moved. Knee chest is an awesome table. It takes a while to get really good at it, and it is worth it for how deep you can set things. I can get people 70, 80, 90% better, and sometimes that last 10% of it holding for weeks, months, a year is setting it on the knee chest to the depth that it wants to be set, because the discs are intricate. Like, you're dealing with millimeters, and if you're not going to set it all the way and give yourself the mechanical advantages of a knee chest table, I strongly recommend it. They're great for everybody. Pregnant women, elderly do well on it. Kids even do well on it. It's not just a table for muscular guys. If anything, muscular guys typically do better on the high-low, because a lot of muscular guys like him, they have dished out thoracic spines and they're already in too much extension. Knee chest table, highly recommend you learn how to use it. I hope this helps. See you next time.